Hello, it's a pleasure meeting you. This is Haejung Lim. I'm a senior manager in Department of Open Data in National Information Society Agency in Republic of Korea. Today, I'm here to share Korea's ICT-based response to flatten the curve of COVID-19. It's been over half a year since the COVID-19 pandemic swept across the world, and in the early stage of outbreak of COVID-19, Korea had quite large number of confirmed cases in the world, but responded to the pandemic with ICT-based safe testing, tracing, and treatment. So, I'd like to elaborate more and introduce the digital government system and private ICT services that Korea has developed to respond to COVID-19 in 3 T: trace, treatment, and test. First, ICT quickly traces COVID-19. The Korean government has utilized ICT in preventing the spread of COVID-19 via travelers entering the country. An example of this is the self-quarantine mobile application developed by the government to monitor symptoms of inbound travelers and effectively support the monitoring of those under self-quarantine. The application largely has 3 functions: a self-diagnosis for the users to conduct and submit the results with the assigned government officers, and a GPS-based location tracking to prevent possible violation of self-quarantine orders, and providing necessary information including self-quarantine guidelines and the contact information of the assigned government case officers. 2 types of the applications were developed, one for the users under self-quarantine and the other for the assigned government case officers. Those under self-quarantine use the application twice a day to monitor oneself, concentrating on 4 symptoms: fever, cough, sore throat, and respiratory difficulties. So once submitted, the self-diagnostics data will automatically be shared with an assigned case officer, who will be notified if the user does not submit the self-diagnostics data or becomes symptomatic. The case officer is also notified when quarantine is disobeyed, in which cases, the case officer takes appropriate measures to have the subject return to the quarantine area. With the spike in the number of confirmed cases in early stage of outbreak of COVID-19, there was heavy workload for the epidemiological investigators. And as a result, the COVID-19 epidemiological investigation support system was developed to support epidemiological investigation through the application of the City Data Hub under the National Strategic Smart City R&D program. The Ministry of Land, Infrastructure, and Transport has transferred the operation of the system to the KCDC, Korea Centers for Disease Control and Prevention, which runs in close coordination with the National Police Agency, Credit Finance Association of Korea, and 3 telecommunications companies and 22 credit card companies. The COVID-19 data platform is designed to support epidemiological surveyors to quickly identify the transmission routes and places that the infected has visited by using real-time analysis of data such as GPS, mobile information, and credit card transaction history to conduct a special temporal analysis. And the COVID-19 epidemiological investigation support system operates in a strict manner to protect privacy, with the scope of collected data kept minimum and due procedures followed in acquiring data. Epidemiological investigators must seek approval from relevant authorities to access the data only when there is a clear need to collect additional personal information. Second, ICT locates COVID-19 with speedy test. As many of you are already aware, Korea has introduced its innovative drive-through testing station that help minimize the risk of cross-infections at the testing centers while maximizing daily testing capacity aimed at rates of new cases. And it has received international attention and commendation. Third, ICT facilitates COVID-19 treatment. The use of AI is expected to reduce the time required to develop medicines, as AI can learn and make deductions based on the virus and other medical data. AI can quickly learn, recognize, and analyze large-scale data based on high-performance computing resources, enabling more accurate analysis and decision-making. Companies in Korea are developing new medicine and relevant platforms through the use of AI, use deep learning algorithms to predict the interaction of drug and protein, and propose candidate medicine for the coronavirus. Well, Korea is not only operating nationwide screening centers, but we are also releasing data on national security hospitals and screening centers, name of the institution, address, phone number, and availability of tests are released to the Open Data Portal in API format and are updated in every day. Using open government data, private sector developers such as civic hackers, startups, and community of developers and portal services were able to launch an application and web services that help public find national security hospitals and screening centers. And speaking of data, there was a mass supply shortage problem in the early stage of COVID-19 outbreak. And considering the urgency of providing information about fast mass sales and ensuring stability of information system, the information service is based on public-private partnership approach taken by the Korean government. In results, there were about 150 apps and web services of checking real-time mass stock inventory had been developed by the private sector within a week. And lastly, definitely not the least, on February 2020, the Korean government established an official website on COVID-19, where all relevant information is available for the public. Comprehensive data such as daily case count in the country, and quarantine process, and regular briefings by the government, and instructions for those under quarantine are provided in the website. Key information such as the accumulated count by the region and the number of tests performed is summarized and provided as a visualization data on the main page of the website. So far, we've looked how Korea has responded to COVID-19. And now, let us see what made Korea quite successful dealing with unprecedented pandemic. First, Korea has established high-speed infrastructure and cloud services as well. And this infrastructure was not built in a single day, but was built from the early 1980s with the government's continuous investment and interest. And second, there was a continuous financial investment by government in ICT. At least 1% of the national budget each year has been invested in national informatization. And also, the active ICT industry and corporate development and the expansion of the market and the people's culture of accepting new technologies and services have all led to a virtuous cycle connected by active ICT. That will be the end of my lecture today. And I hope the information and experience of Korea may provide a valuable solution to help your country and community to fight against COVID-19. And thank you so much for watching.